Hi everyone, welcome to a presentation about 5 topics regarding mental health. So my name is Josh Manjan. I'm a mental health counselor located in the state of Maine. So I'm going to start this presentation and give me a second to share my screen. Wrong one. Let's try this again. Okay, one more time. Okay, here we go. So mental health top 5, and essentially it's going to be on 5 ways to improve one's mental health. So I'm going to start off with a common thing I see as a counselor, and that is what we call intrusive thoughts. So I'm going to define intrusive thoughts as kind of thinking or images and impulses that are not wanted and can seem like they come from nowhere or really feel incongruent to the self. So what I mean for incongruent is this idea that sometimes we have thoughts that really go against who we are. It almost we can feel shamed and be like, wow, that's kind of messed up that I have that thought. Or really, I don't want to think that way. Like, I don't want to feel so down on myself, but I'm having those thoughts anyways. And that can create kind of this really yucky feeling of I'm not thinking of what I want to be. And I feel really kind of separated between who I am and the thoughts I'm having. So, a lot of times, intrusive thoughts occur quite common, intrusive thoughts are quite common, and really when they start to have an impact on us, typically they're seen as negative. And so it could be negative thoughts of self, again, like I'm a horrible person, why did I do that, I shouldn't, even be alive. It can be really, really degrading to constantly have this negative tape recorder playing in our head. So it could also be negative thoughts of others. So again, having these thoughts, these images, and even impulses that are rather negative, not only towards ourselves, to other people, and then sometimes too, thoughts can be impulsive. So, for example, it's not uncommon. There's this interesting phenomenon where sometimes if you're standing like near a cliff, or even looking at the ocean, we can have this impulse to kind of get closer to that, whether it's walking into the ocean or kind of walking towards the edge of the cliff. People kind of feel compelled to do that. We would call that impulsive. In addition, we have this thing called grandiose thinking, where we can kind of have intrusive thoughts that feel fantastic. It makes us feel we are in a better place than we're at. So, an example of grandiose thinking could be, you know what? I'm just going to buy a yacht. I don't have the money to do that, but screw that. I'm going to buy a yacht. I'm going to find a way to do a yacht, or excuse me, I'm going to find a way to, to have a yacht and make it happen. And then that's what we would call kind of grandiose thinking. Um, so the big thing to remember with thoughts is that thoughts can impact how we feel and how we behave. So if you look at this graph that I have, we have this what we call the CBT triangle, which CBT stands for cognitive behavioral therapy. And essentially, what makes up this triangle is thoughts, behaviors, and emotions, also known as feelings. So, what we think affects is how we're going to feel and act. How we behave or what we do affects how we think and feel, and how we feel affects what we think and do. So, if we have intrusive thoughts, then those thinking can impact how we feel and how we behave. So if we kind of address those negative thoughts, that's going to increase a more positive sense of feeling as well as promote behaviors that are more congruent. Addition to this, maybe the intrusive thoughts are very powerful, so we can focus on acting in different ways. Again, if we change the behavior, we can change the thought, as well as if we change the feelings connected to those emotions, or excuse me, change those feelings connected to those thinking, that can change our thoughts as well. So really that kind of premise is very common in many forms of therapy. Not just CBT, which kind of has this triangle, but most forms of therapy feel that if you change one element, whether thoughts, behaviors, or feelings, that's going to influence the other portions of the triangle. So we also have emotion focused therapy, which again, if we focus on the emotion, that's also going to create and promote shifting in our behaviors and feelings. Same with behavioral therapy. as well as with psychodynamic therapy. Most major therapies are addressing thoughts, feelings, and behaviors. If you change one, it's going to influence others. So, a very common complaint is feeling stressed. Now, it's important to remember that stress is beneficial. So, how our brain learns is under some sort of stress. We'll remember something in an aroused state. So, stress can be acute and it also can be chronic. So, again, some levels of stress can be greatly beneficial, what we call eustress, right? So, there's probably times where you felt a lot of stress and maybe an anxiety from a certain situation, and you've learned, you know what, I don't want to do that again. In addition to that, we also have chronic stress. And chronic stress is feeling stress for a longer period of time. And that's where the damage can come into play. So think of stress kind of like exercise. Certain resistance or certain moments of kind of toughness is allows our muscles to grow. However, the longer we're lifting weights, the more prone to injury. So, in order for my muscles to grow, I need to add some sort of resistance, some sort of weight to the exercise I'm doing. But if I'm constantly doing that exercise all day, I could possibly result in damaging to the body. So we need times of rest in order for stress to kind of go down to healthier levels. So the thing with stress, especially for mental health, is stress is a combination of physical as well as psychological components. So what I mean by this, when you're feeling stressed, you have some sort of bodily sensations that kind of is interpretive to mean stress. So the body sensations could be my palms that get sweaty, I have shortness of breath, I notice too my mouth gets dry, I kind of feel tightness in my stomach area, maybe there's some sweating going on. So all those sensations I can have without being stressed. But those cues get interpreted as, okay, in this moment, I'm feeling this way because I'm stressed. So we need both a physical combination as well as a psychological interpretation to have awareness of stress. So again, that's the physical component. So obviously, addressing the physical elements can reduce stress for sure. You hear all the time, like, all right, you're feeling stressed, then work out. Another way too we can focus on is the psychological component, right? Because again, stress is both physical and psychological. So when we analyze the psychological component, typically what we see is stress is focusing on either the past or the future. So with stress, we may have intrusive thoughts that are kind of on this repetitive hamster wheel of either thinking about past events or future events, maybe the unknown. So if it's all about either past or future, what is missing? And again, I want to really emphasize that this is about chronic stress. Acute stress for sure can be on the immediately present, but chronic stress typically is past or future. So to deal with chronic stress from a psychological component, we want to focus on the present. So one way to do that, and I'm sure this is not new, you probably have heard the benefits of mindfulness, but here's a simple rock that I have in my hand. So I want to focus on being in the moment. And one way to do that is by taking an object like a rock or a pen cap and moving it in my hand without really looking at it. For demonstration purposes, I'm trying to keep this on the camera, but typically I would have it out of eye reach. And what I want to do is I want to describe this to myself, either out loud or in my head, of what I'm noticing with the rock. So I'm going to describe the rock. So I notice there's pointy sides to the rock. There's also kind of a shallow groove. And I'm also noticing that the rock is cooler than my hand. And I can move that rock to different parts of my hand and notice different sensations. So right now, just from doing that, I feel less stressed. The more we practice being in the moment, it allows us to have a preventative factor on chronic stress. So the one thing though, most of us can be in a state of chronic stress. So it's hard to start beginning mindfulness activities. What's really common, what you'll hear is someone tries to do either breathing, a mindfulness activity such as listening to audio tape, or maybe a focusing activity like focusing on a rock. But what happens is the stress doesn't go away. And in that moment, it is easy for intrusive thoughts to kind of overshadow and be like, hey, this isn't working. Things are never going to work. You're screwed for life. And obviously, that's going to make us feel worse. So, what I kind of inform people is practice this when you're not at your worst. Because if you try it at your worst, it may work, but it's going to be difficult. So, think of it as running a marathon without training. Some people can do it, but it's probably going to be a hard time. So the more you practice this, not only is it going to be preventative, but it's going to be easier to utilize in times of kind of increased stress. So let's go on to the next slide. And again, this is kind of chronic stress. Chronic stress can have huge impacts on our body. So not only can it cause issues with our stomach, uh, decrease our immune system functions. It can also decrease our sex drive. We're going to feel achy. We're going to have could even have low bone density. And so, really, especially from a psychological element, stress can really impact our mood, increase our kind of anger, maybe feelings of depression, irritability. We may feel lack of concentration. It's harder to kind of focus on the moment. We may have sleeping issues, headaches, and this could also kind of lead to more chronic mental health issues such as depression, anxiety, um, you name it. So really, chronic stress, we want to find a way to impact it and decrease it as much as we can. So, psychological signs that we're in chronic stress could be agitation, feeling hopeless. So, like the future just feels pretty lame, not much to look forward to, just there's no hope. Self neglect could be you've just stopped caring about your well being, hygiene's kind of lacked, or you just don't really care anymore. You're kind of in the fuck it stage. So, self neglect, again, this is kind of what we call learned helplessness. If you're chronically feeling stressed, you get to a point of why even try. We may even see personality changes, someone that's more open and outgoing. The next thing we know, they may have decreased. Um, they may no longer be as friendly as they used to be. They may be withdrawing from social groups. They may be more irritable. Just the person does not feel the same. And that kind of leads to anxiety. So, anxiety and stress can go hand in hand, but there is a unique flavor of anxiety. So, anxiety, again, to remember with all of what I'm talking about in today's slides, is all of these experiences are normal. What happens though when they become chronic, then that could lead to what we call a mental health issue or a mental health disorder. So again, we've all have experienced grandiose thoughts or intrusive thoughts at some point in our life. We've had moments of chronic stress and we're going to have moments of anxiety. So moments of anxiety are normal. Again, just like stress, when anxiety is chronically impacting our daily life, that's when we see it as a problem. So anxiety is going to show many similar signs of stress. Yet, in my view, how I distinguish between stress and anxiety is typically stress mixed with worry, dread, and fear. Okay? So, typically, again, if we're talking about chronic anxiety, that worry, dread, and fear typically come from past events or focused on the future events. Acute anxiety is going to be present in the moment. So, and no doubt too, an anxious stimulant will or anxious trigger is going to increase worry and dread in someone who's prone to that. Typically, again, that worry, that dread and fear, especially chronically, is going to be focused on either the past or the future events. So we can kind of generalize anxiety in three major ways. So one of them is general anxiety, also known as free floating. So what we mean is we don't necessarily know the causes of anxiety. It's not a specific trigger or event, but it is just like I'm anxious. I feel like I'm always anxious. I'm anxious about everything. It's just like chronically there. That's what we call free floating or general anxiety. We can also have specific anxiety, which could be a social anxiety or a specific phobia. So, like here, I have a cougar. It could be fear of cougars. That would be a specific element with that. We know what the cause of the anxiety is. And then another element is existential anxiety. Existential anxiety is kind of hard to extinct or to describe, but essentially, an existential anxiety is like having anxiety that's connected to being human. So maybe it's the fear of our mortality. Has to be anxiety connected to feeling isolated or alienated or just kind of understanding who we are and staring into the void of humanness or just feeling overwhelmed with just life. Could have more of I am just fearful of death. I'm fearful of existence. I am not hopeful of humanity. It could go on and on, but it's more of a really questioning our sense of self can create existential anxiety. So, what's nice is general anxiety and specific anxieties can no doubt, we can use a lot of techniques, and there's a lot of kind of workbooks to utilize that can really help us with this. A meditation practice can be beneficial, journaling, etc. But from my view, typically existential therapy, it is, or excuse me, existential anxiety. That's a when we're feeling that way, it may be really beneficial to seek out a kind of mental health professional who's been trained to address those ideas. Because existential anxiety, we really a way to kind of decrease that is we need to find purpose and meaning. Because a lot of times the anxiety comes from not really feeling purposeful, not really feeling like you have some sort of meaning in life, very nihilistic, like there's not a lot of hope. So existential anxiety can be benefited from uh, having someone work with you to find ways to foster new meaning and new hope. So it doesn't have to be a mental health provider. There's some people benefit from like spirituality and religious interventions as well. But something that gives some sort of peak experience, some sort of personal meaning, can really help with existential anxiety. So we're going to go to the next one, which is sadness. Again, feeling sad is a normal human experience. When it becomes chronic, again, sadness can turn into a problem. The thing to remember, because I hear this from a lot of people, sadness is seen as a negative feeling. A lot of people don't want to feel that way, and so a lot of people try to avoid that feeling altogether. We do that with a lot of negative feelings. So, the thing to remember with sadness is we feel sadness for a reason. Sadness can be seen as we experience this emotion when something important to us has been taken away or lost. So when that has happened, that's why we're feeling sad. Okay. So again, normal experience to feel sad. Um, in addition to that, we have another form of sadness, which again is more nuanced, but what we call grief and bereavement. So this is a normal process when we experience something, some sort of loss that was very, very important to us. And the thing to remember is everyone's going to grieve differently. How you grieve may be different than how I grieve, and the time frame may be different as well. Just because someone's going through grief does not necessarily mean they're having a mental health disorder. Again, everyone grieves differently, the timing may be different. Grieving can be shifted into a mental health disorder when the timing is no longer seen as acceptable in the culture. So typically in the United States, there is debate about this, but grief that is a year or longer can be seen as complicated grief and may be treated as a mental health disorder. But again, the big thing to remember is we're talking about sadness. Sadness is important. Sadness is we're feeling it for a reason, and typically it's because something has been taken away from us and lost. And knowing that, it can be a good starting point is how or where do we go from there? I've lost something important to me, so what do I do now? kind of component. And again, sadness is a strong emotional cue. Our brains are hardwired to respond to powerful emotions. Because sadness, when we feel like something's been lost, it could also be showing to others that we want help and we want support. So sometimes when someone is showing sadness, they may also want someone to be there for them. Not always, but that could be sometimes what's needed as well. Again, everyone's going to respond to sadness differently, but we can see it as something important to us has been taken away. So now, because of that, I'm feeling sad. Connected to that, we have depressive symptoms, and these are depressive symptoms are really, really common. So that's why I'm kind of focusing on this. So depressive symptoms, depression, when we look at the DSM, which is the Diagnostic Statistical Manual of Mental Health Disorders, 5th edition, published by the American Psychiatric Association, has a lot of different criterias and symptoms that fall under the depression kind of spectrum or the depression family. So again, everyone's going to possibly experience depression differently, but here's kind of a list of common symptoms that are seen when someone may say they're feeling depressed. So again, we're going to have feelings of helplessness and hopelessness, right? So as you can see already, a lot of what I talked about overlaps, right? So we can have helplessness and hopelessness when we're feeling chronically stressed. We may be having that with certain types of anxiety, and then we could be feeling that with sadness. And then again, helplessness and hopelessness can be intrusive. So that leads to the next one. We could have intrusive thoughts. It could be negative intrusive thoughts, such as you're a dummy, you shouldn't be feeling this way, no one likes you. It could also be having intrusive thoughts of what we call suicidal ideation, or having thoughts of no longer wanting to live. We could even have a possible plan of ending our life. So in those extreme cases, we would want that person to seek help, because no doubt they're probably experiencing a lot of pain, and we want them to know there's a lot of resources out there to reach out and help. And then I'm going to include those resources. If you look at the bottom of the uh, the bottom of the video, in the description, there'll be some resources for there. In addition to, we're going to see loss of interest in daily activities, so some sense of withdrawal. The pleasure is just not as good as it used to be. You may see some appetite or weight changes. So it could be a decrease in appetite or increase in appetite. It could be decrease in weight or increase in weight. We're going to see sleep changes. Again, that can include decrease in sleep or maybe increase in sleep. Maybe some anger and irritability, a loss of energy, self-loathing, so kind of self-hatred. We may have impulsive and reckless behavior, maybe have difficulty concentrating, and then unexplained aches and pains. So again, a lot of these may overlap with what we already talked about today. So the big thing to remember is the list can go on and on, where people can experience depression differently. So really the purpose of all this was kind of just talk about major kind of symptoms that we all experience that could lead to mental health disorders, just to kind of be aware of not only our own mental wellness, but others as well. And really, especially when you're feeling kind of depression symptoms, it can be really beneficial to have the awareness of when you start to feel this way and to seek out help when these symptoms are being demonstrated. Because like anything, the earlier the intervention, the more preventative we can get into increasing the symptoms. So if we treat it earlier, that's going to prevent the symptoms from increasing. Also, too, with depression, from my own clinical experience and my own personal experience, depression is really good at creating this internal narrative or internal thoughts that we are uncurable, that we're always going to be depressed, and we're always going to be hopeless. Okay? So those are always kind of components. The thing to remember is that depression, it can get better. I can say that with 100% confidence, that depression does not have to be chronic. Like almost every experience we've had in life, it doesn't last. So same with sadness, right? People don't like feeling sad because they're worried they're going to feel that way long term. Most of us, however, do not feel an emotion long term. Emotions quickly come and go. With the right help and support, depression can go away or be decreased or be manageable. Depression does not always have to be in this dark, gloomy state. There is a lot of hope. There is a lot of progress that can be made. I myself have experienced it, and I've seen people experience it. Again, when working with someone who's experiencing a lot of kind of what we call major depression, the hope is gone. And they feel very hopeless, and there's a lot of dread, a lot of gloom. But, but I have seen those people who felt like there was no hope to greatly improve and have meaning and purpose in their life. So remember, with depression, there is definitely hope. So we're going to end there. Thank you for your time, and I hope you have a good day. I'm going to stop sharing the screen, and we're going to end.